Bismillahirrahmanirrahim. Assalamu alaikum to doctors and welcome to our speaker, Dr. Zoobia Ramzan. Myself, Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, today's session on behalf of Genix Pharmaceutical Management. Genix Pharma has founded in the year 2004. We have vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improve the lives of people associated with us all level because we are dedicated to good health. Today our session is part of educational activity and presentation topic is dementia and Alzheimer's management presented by well-known consultant psychiatrist of Pakistan, Dr. Zoobia Ramzan. Dr. Zoobia Ramzan is FCPS psychiatry. She is consultant psychiatrist and in Dr. Abdul Qadir Khan Institute of Behavioral Sciences, Dow University and Health Sciences. She is assistant professor here. She is also doing her private consultation in Health Icon and Jamal Noor Hospital, Karachi. She is professionally very busy person, but always available for education. Thank you so much, madam, to join us. Dear doctors, if there is any question, please drop your question in question answer box and question answer session will be after presentation. Over to you, madam.
Assalamualaikum. Thank you, Asim, for my brief introduction. So today's topic is on dementia and role of treatment in this dementia. So conflict of interest that it's a webinar is for educational purpose and for drug promotion. Okay. So as you all know, dementia is a brain disorder, but psychiatrists, neurologists, and multidisciplinary team mostly treat it. So it's a impaired functioning that interferes the person daily activities and their relationship because of that disease that they are unable to remember things. As there is a memory loss, they after if disease progress, they have language difficulty, they are unable to perceive things, and they are unable to decide major activities or major decision in their life. As you all know, it's a myth that dementia is an aging process, and everyone, if is going or she is going to be old, she has to or he has to face the dementia. It's not that about. Okay, dementia is a disorder. Okay, it's due to genetic problem, Alzheimer disease, and if a patient is hypertensive and diabetic, then he has vascular dementia, and there are other types of dementia. It's not an aging process as the people or as in past people were thinking. Okay, as we have age-related memory changes, but because of dementia, this age-related changes got worsened over time, and people have difficulty in remembering name and places, and they are unable to handle their routine. Okay, and in later they have difficulty in doing their jobs, or they are unable to make it a happy life with their family member because of their behavior change, because of sleep disturbance, because of appetite problem. They are unable to remember whether they have eaten or not, and they have difficulty in walking. They are unable to balance their gait. So there are further difficulties in life as the disease is progressing. This is the progression of symptom in Alzheimer disease, starting with the mild symptoms, and then with moderate symptom, and then with severe symptoms. Severe symptoms that they are unable to remember where the washroom is, and sometimes they have a bladder incontinence, and they are unable to move freely, bedridden, and they are unable to remember their roots, where they are living or where they are not living. They are not accepting that they are living in the same house. They are unable to change their dress. They are unable to eat themselves. So this is the thing. And wandering out is in moderate Alzheimer disease. So there is a personality change and overall change in the patient personality, that he is unable to manage things and dependent on the family. As we all know, in Alzheimer disease, the main problem is not patient is telling you what he has. The family is the one that recognizing the symptoms and informing the doctor. If a patient is coming to you with a memory problem, you have to differentiate whether this is a depression or this is the start of dementia. Okay, mostly with the patient with the start of dementia, they have some memory, but they are unable to remember each and everything, and they have no awareness that they are not understanding things or they are forgetting things. Okay, but family knows that they are forgetting things. Okay, so the mostly the problem is a burden on the family. Okay, if the family is informed enough and they have psycho education about the disease process, then these families are able to handle the Alzheimer's patient, because the routine of that Alzheimer patient is changed now. Their sleep is reduces from 8 to 4 hours, near about 4 hours, and they are unable to manage their home life, their occupational life, their social or even personal. They are dependent on the family. Okay, so if family is well educated, then they are able to handle their patient with the Alzheimer disease. So as far most burden is on the caregiver, and we have to inform the caregiver. Treatment are available. Mostly treatment which are available in the market is choline esterase inhibitor, rivastigmine, donepezil, and galantamine. We are mostly talking on rivastigmine. As you know, rivastigmine is the acetylcholinesterase inhibitor, and its work on acetylcholine as well as on butyrylcholinesterase. So it's the only drug available which has mechanism, two mechanism on that acetylcholine and butyrylcholinesterase, which are helpful in degradation of the acetylcholine. And rivastigmine is the only drug which can be used in Parkinson's disease, and now some evidence available that is helpful in vascular dementia. These are the few evidence-based medicine reporting showing the article showing the role of rivastigmine in Alzheimer disease, and this is the meta-analysis which show that it's helpful in majority of Alzheimer patient, but mostly it's recommended for mild to moderate and sometime in moderate to severe if patient is not responding to other treatment. So this is the another article which shows that it's helpful for mild to moderately severe. So it's another article in Alzheimer which also shows that it's helpful for all types of severity of Alzheimer disease. Okay, so there is another study with there is a if a rivastigmine is added with the donepezil, so it can help a patient with the Alzheimer disease. So it's also a study which show that prevalence of Parkinson disease, and the treatment shows that it was helpful in Parkinson patients, 78.2%. There was another study which shows that the rivastigmine use in Parkinson disease with dementia, it's helpful in improving their cognitive functions. So it's another study which shows that it's also helpful in dementia with Lewy body. So multiple studies have been done which shows the improved memory and other memory function if patients are on rivastigmine. Okay, so there is also use of rivastigmine, as I told you, in vascular dementia. So we can use rivastigmine in patients who are having the vascular dementia suffering from diabetes and hypertension. So they can improve their cognitive impairment with the use of rivastigmine. So nowadays, new evidence are coming that rivastigmine can be used for vascular dementia. As we know, in vascular dementia, there is no drug available to help the patient until we have to manage their hypertension, diabetes, and other cardiovascular diseases. So this is another study which shows the rivastigmine use in patients suffering from cerebral vascular dementia. And as you know, it's very common vascular dementia is the second most common dementia in the whole world. So rivastigmine is very helpful in managing this vascular dementia along with their hypertensive and diabetic drugs. So, and it's also helpful to improve the cognitive function in patient who having a brain injury after trauma, after road traffic accident, or after some major collision of brain. So it's improved their cognitive deficit, which mostly develops after or develops after the injury. Even in patients with the elderly patients who's having the delirium, or it's which can cause dementia too in long term. So it's helpful if you use rivastigmine in that patients. Okay, so there is also a follow-up if a patient with Huntington disease have dementia problem or cognitive problem, so we can use rivastigmine to help or improve the cognitive functions in these patients. So if psychiatric patients, schizophrenia, do have some cognitive impairment, if they are going to older age, so rivastigmine can also improve their cognitive function, but there are limited studies available. But if there is no problem, or if there any other drug interaction or any other problem, we can use rivastigmine, as rivastigmine has minimal to no drug interactions and no effect on cytochrome P450. Availability of rivastigmine, the name of Riveme, it's available in capsule in the form of 1.5 milligram and 3 milligram, and oral solution is also available, and 0.75 milligram is equal to 1 ml. So we can treat mild to moderate dementia patient, or we can treat the severe dementia patient and also with Parkinson's disease. As you know, the dose mostly go with the monotherapy and start with the minimal dose, then titrate the dose. So we can start the dose with 0.5 milligram twice a daily or once daily, because it's a very short half-life. So we have to divide the dose accordingly, so the patient can have the improvement in cognitive function. But as you know, at least the drug needs some time to improve the cognitive function. So we have to inform the family that sometimes the medicine will take time. So you have to wait for the improvement after giving the medication. And you know, the maximum dose is 6 milligram to twice daily, it's 12 milligram. Okay. So challenges in the therapy at, you know, that it's very expensive. Me Too's available in Pakistan, and Rivime is the only drug which is it's easily available, and it's cost not very much expensive and cost effective, and we can help the patient with different type of dementia with this drug. So to see the financial crisis and financial issues going on in our community, and we have to help the dementia patient, so we can prescribe them this drug. As you know, this in the last few slides that we know that dementia is things are going good with the medication and the quality of life, the patients are improving. So in few years, we have to face the challenges to see or save the lives and to improve the quality of life of old patients. So dementia will be increases in our world. So we have to improve their activities of daily living, their behavioral disturbance, their cognitive functions. So we have to prescribe them good drug with minimal side effect. So mostly the side effect which acetylcholinesterase rivastigmine is that has effect on gastric symptoms. The patient can have nausea or acidity, or sometimes they have headache, but mostly this is very safe because of no drug interaction, and it has no role on cytochrome P450. And after use of rivastigmine, we can improve the cognitive functions. And if the cognitive functions are improved, then their activities of daily living is also improved, and their behavioral issues are also improved, and the quality of life of patient and burden on the family is also reduces. So adverse effect, mostly as I told you, it's mostly on gastric symptoms, but no other major side effect reported. And if the patient has some hypersensitivity, then we cannot prescribe in a long term. There is no contraindication, as it had no role on cytochrome P450. As I told you, its half-life is mostly low, so we have to titrate in a two-time dose so to improve the cognitive functions in a patient. So as I told you, it's available in a capsule form and also in a syrup form, and 0.75 ml is containing 1.5 milligram of rivastigmine, and it's freely available and cost effective. 1.5 is about near about 60 rupees, 65, 60 rupees, and 3 milligram is near about 80 to 85 rupees. So it's the only available rivastigmine in our part of region with a cheaper rate, and it's effective for a patient for dementia. Thank you. Any questions so far?
Thank you so much, madam, for your wonderful presentation. Madam, we have a question in chat box from Yasir. Assalamu alaikum, Yasir from JPMC Neurology. Can we give rivastigmine in stroke patient? Does it possess any benefit over donepezil?
As I mentioned few articles that we can give it to a patient with cerebral vascular accident. Stroke is what most commonly seen in our society because patients are not using the hypertensive very frequently. They are using it. So as I told you, rivastigmine has minimal to no drug interactions and it has no role on cytochrome P450. So it is more beneficial than donepezil if a patient having some cognitive impairment after the stroke.
And madam,
Any other question?
The second question is how it is better than memantine? Is it because memantine is widely used and prescribed by our community? If rivastigmine is much better, what are the perks of rivastigmine over memantine?
As you know, basically we are using memantine only for severe type of Alzheimer disease, not for mild and moderate type of Alzheimer disease. Memantine is for severe Alzheimer disease, but if a patient is having the mild to moderate and dementia, so we have to treat with rivastigmine. And sometimes we are facing the challenges that the patient with severe Alzheimer disease are not getting better with memantine. So we have to give them the add-on therapy with rivastigmine or other type of acetylcholinesterase inhibitor, and patient then they are responding. So we cannot say that memantine is the best drug or rivastigmine is the best drug. The evidence mostly that you have to treat the patient with the severity of Alzheimer disease, not the best drug is available. Okay, if the patient is having the mild, you cannot treat that patient with the memantine. You have to treat the severity according the guidelines recommendation, not the best thing is available in our society. Okay. Any other question?
Thank you so much, madam, for your clarification. And thank you so much for your comments, madam, for our Riveme also. Bundle of thanks.
Okay, sorry, there is one question. If rivastigmine with memantine is not working, then you have to see whether you have titrated the dose accordingly or not. Give the patient maximum dose and check the compliance. If patient is not responding, what doctor are doing? Doctor is not asking whether you are giving it regularly or not. And you know, anti-dementia drugs are very expensive. Is family is able to buy that drug or not? Is they are able to provide them regularly or not? Okay, it's not just like a Panadol, you have a fever and you have to give it at that time. Okay, so because of financial crisis, mostly family is unable to give them regularly. So we have to check the compliance and we have to see whether they are able to buy that drug or not. So why the drug is not working? If not working, then reach to the maximum dose and you can add on therapy. Thank you.
Thank you so much, madam. Thank you.